Good morning. Thank you to everybody. Last night was so much fun. The jamming jammies, the teen time. I heard karaoke was a blast. Also, I think I'm supposed to say that whatever happens on the 18th floor stays on the 18th floor. We have so many fun activities that we can't wait to do again next year. So a few announcements. You can register until 11:30 for the walk today. Donations are welcome. We have bibs out there that you can customize. And then so we'll plan to take a picture around 11:30. So you can register up until 11:30 this morning for the walk. And then after the walk, so we'll have an indoor option and likely an outdoor option, but we'll have all those details finalized when you meet up here at 11:30. And then after the walk, we'll have the picnic on the 18th floor around 12:15, but just come on back after the walk. And next, so our first speaker, I'm so excited. So innovation is one of the pillars from our strategic plan. So innovation is so important. Without that, we wouldn't have all these new advances, new technology, new doohickeys and devices. And Oley wants to know, how is our role in that? So we want to help, people that have an idea, help them develop that, get that off the ground. And so I'm honored to introduce our first speaker, Chaitenya Razdan, with his talk, How a Three-Pronged Approach to Innovation Can Enhance a Patient Experience. So welcome, Chat.
Thank you all. My name is Chaitenya Razdan. It's so wonderful to meet you all. Oley is super special to me. Joan and I were reliving when I started my company, Karenware. She was the first person I cold called, being like, this foundation sounds amazing. Maybe we can partner together. And she said, would love to work with you. What do you need from me? And I think that was kind of an important element of giving me my confidence and realizing that you can do a lot of things just by asking. So as Andrea said, my name's Chaitenya Razdan. I'm the founder and CEO of Karenware. And just to have the standard disclosures, I am a founder and CEO of a company that tries to, I think tries is probably the best word, to help the community. I'm a board member on a lot of nonprofits. The one that's probably most relevant is the Association for Vascular Access. Super involved with my undergrad, UVA. If anyone ever wants to go there, let me know. I probably can't help, but I can tell you how great it is. In my spare time, I also help teach a digital class on product innovation for Parsons School of Design in New York. And I am probably the smallest investor and a board advisor to a bunch of startups. So today I kind of have three things that I hope that you all can help learn from and get out of this talk. First is just understanding the importance of both the consumer and the clinician in the design process. And I think when I started Karenware, it was something that was near and dear to my heart. I remember as a child just how terrible it was going into the hospital all the time and not having products that I felt allowed me to be me. And I think that's really, really important. And after today, I really hope that all of you feel empowered to get involved and to help come up with better solutions. The second one is the three-pronged approach to product development and design. It's an approach that I have taken from day one, and I think it'll be really important to help you all as you start to think through solutions. And then third is a 7-step design process that we undertake on each and every one of our products, and allowing you to kind of undertake something similar as you start to look at problems and try and come up with solutions. One really important thing actually to note is my background. because I always tell people it's completely unrelated to anything that we're doing. And so my background is I'm a former strategy consultant, worked for a company called Kearney, and former investment banker, worked for Goldman Sachs. So I say that not to brag at all, but rather the opposite, to say that I know nothing and I've been able to help start a company. And so I think a lot of people always worry, like, I don't have a background in this, I don't know this. I didn't even cover healthcare in either job. I mean, I always joke that I'm Indian, so like I'm bound to know something about hospitals, and my mom's a doctor. And so I kind of grew up around it. But most importantly is, honestly, starting a company or coming up with a product is I want to do something. And that's really what matters at the end of the day. So I'm going to do a really brief overview of why I think my background is relevant and all that, and kind of what got me down this path and this journey. So historically, when you think about it, when you go into a hospital, everything that you're given is a constant reminder of what you're going through. And you look at the patient gown. I know as a kid, I had tubes in my ears 3 times, and I would always be terrified of going into the hospital. First and foremost, terrified because I'm getting surgery, obviously. Secondly, even more terrified that I wasn't the cool kid getting his tonsils removed. All of those guys at the least got ice cream for the next week. I still had to eat broccoli and green beans. But most terrified of the fact that I actually knew everyone operating on me. My mom is an anesthesiologist, and like any mother who's a doctor, she made sure that all of her mentors and friends were the ones operating on her son. I would say her favorite son, but candidly, I'm her only son, so I don't think she had a choice. But that forced me to actually know everyone operating on me, and I remember being terrified of everyone seeing my backside in the hospital. And so making sure that we incorporate that 7-year-old version. Other products include, like, babies in the NICU historically have been wrapped in a blanket because no one's ever created clothing that allows them to be in the NICU. And then what actually started the company was the PICC line. I had loved ones told to wear a sock over their PICC lines. Those were the fortunate ones. Other ones were given stretchy gauze to get place over the PICCs. And so really, at the end of the day, everything has always looked pretty terrible. And so my goal in starting Karen Wear was really just to try and create a brand for consumers and clinicians that were designed by them as well. So using a bunch of fashion and design that allowed us to incorporate the latest trends, technologies, and designs. I'm actually wearing a hoodie designed by Oscar de la Renta for us. Actually has zippers on either side that open up and get access to the port. And I think this is really important because we joke with Oscar that this is probably the cheapest product by like 1/10 of anything else that they sell, but it's super important to them. And if you can get a brand like Oscar de la Renta to want to do something for the community, I think it really goes to show you anyone and everyone wants to be involved. And then lastly is really building up a brand. So at the end of the day, our goal and your goal should be to allow everyone to feel like themselves in and out of the hospital, to go about your everyday lives, and to do whatever you want to do without thinking about what you might be going through, what you're wearing, what you might have on you, etc. So going back to some of these products, at the end of the day, consumer feedback has been something that's been lacking. I think when you think about historically medical solutions, companies have done a tremendous job of coming up with the solutions. So for the patient gown, for example, everyone historically always created a gown with the backside open. You might wonder, why is your backside open in a hospital? It's because when you're bedridden, you actually don't want fabric between you and the mattress. And so they do that because in a hospital, most of the time you're lying on your back and they want the back open. And so that was clearly designed by a clinician, not by someone that actually was going to be lying on a hospital bed in a gown, walking around with the gown. And so that is why it's so important to have the people who actually are going to be wearing the products involved in the design and development. Obviously, it's really hard to get a NICU baby involved in design and development, and so that's, in cases like that, you want to get the families involved because their interactions are probably limited to cries and smiles. But even then, like the hospital socks, I think that's something that to this day baffles me why they use them besides cost. But trying to think about, again, bringing that consumer perspective into it. And so at the end of the day, I think this slide is really just meant to remind you all that you can make a difference and you can design products that look good and feel good. All right, so that was enough about my background and why I think this is important. Now I think let's get into the heart and meat of the presentation. So at the end of the day, we want to ensure that your voice is heard as a consumer. I think we always go back to, like, when you go into care, I think the best doctors, the best nurses are the ones that incorporate you into the feedback and incorporate you into just feeling good and feeling like you are empowered to have a part of your care. And I think this kind of feedback is even more important when you think about the product that you're wearing and what you will be going about doing each and every day. I think the other thing is you don't want to overthink things. For the longest time, I always have wanted to create a shower sleeve because I had a lot of broken bones as a kid, and I remember wearing literally a trash bag on my arm while I would shower. Looked terrible, but as the founder and CEO of a design company, I refused to come up with something that wasn't the coolest looking product ever. And then finally, a bunch of consumers were like, you got to remember, you're trying to create something better than a trash bag. Yeah. You don't need to create the next, I always wanted to do the wetsuit. So like in my idea, I think it'd be really cool to have a neoprene cover. And the feedback I got from everyone was, wetsuits get wet, so it doesn't really work. And I was like, oh, yeah, okay. And so I think that's why it's important to also think through and have consumer voices heard. This is my favorite math equation of 1 + 1 = 3. And I think it's something that is really, really important. A lot of us go out trying to solve problems on our own. And I think when we do that, we miss the magic of working together. At least that's the excuse I give my team when I tell them I want them working in the office and not remote. But no, all bad jokes aside, first and foremost, when you think about it from a consumer standpoint, right? If I were to ask you all to draw a solution for something that you wanted, you would come up with something beautiful. It would look amazing. It'd be really, really cool. But at the end of the day, it might not actually meet your provider, what the clinicians want. So a great example is for PICC line covers, when we created that, I remember I spent 9 months designing this really cool sleeve. It looked like just as good as LeBron James' compression sleeve that he wears when he plays basketball. And my idea was like, obviously I'm going to get LeBron James to wear it. Neither worked out. But as we started talking to the nurses and doctors, their comment was, well, you need a window because you need air for the dressing to function. And I wouldn't have known that because I wasn't a clinician. I didn't know the medical needs. And that's why as a consumer, it's important to bring the clinicians involved. On the clinician side, it's just as important to bring the consumer's involvement. When you think about what clinicians have created and what they've solved for, they always are thinking about what medically is going to be better for the patient. They're not thinking, the consumer. They're not thinking about what does the consumer actually want to wear. And I think, by the way, I love the word consumer. I think Karen Ware is totally stealing that word as well. But I think that's important. Total aside, a lot of hospitals now are starting to think of patients as hotel guests. And they're hiring a lot of hotel executives as executives in the hospital. And I think it's important that clinicians realize when they're coming up with a solution that they're also incorporating feedback from the consumers, the end users, et cetera. And then lastly is designers. My favorite story is, does anyone here know of Diane von Furstenberg? So she created the most beautiful patient gown I've ever seen. She did it in collaboration with the Cleveland Clinic. Every single gown costs over $200. Hospitals, just to give you a sense of that cost, hospitals go through about 1,000 patient gowns per bed per year. So you're talking about something that for the Cleveland Clinic, they probably spend about $50 million a year on, that if they had used her, I'm really bad at math in my head, but it probably would have been around like $2 billion. No, that math's off. $200 million. So just a bit of an extra cost. And I think that that's why design is important, and having designers like Oscar de la Renta is awesome to get involved, but you can't let them go off on their own. Otherwise, you're going to have things that are completely out of control. And so at the end of the day, it's really, really important to bring everyone together and design products combined with everyone to ensure that everyone's needs are met. So this is the 7-step design process that I like to undertake whenever we come up with a problem and try and solve for it. This is definitely nothing special. It's like what we've kind of come up with. I think it works really well. I have no hard feelings whatsoever. If you tell me this sucks and you have a better one, always looking to learn at the end of the day. So the first thing is you want to identify a problem. And I think that a lot of people, when they're thinking about problems, like the way that my mind is wired, I'll think of a problem and I'll immediately try and think 50 steps ahead to what is the solution, what is going to make sense. And I think the proper way to do it is think of a problem that you don't worry about what is better, what's going to happen, just what is annoying you or what could be better. What is a problem that you're worried about? And for me, when I started Care and Wear 9 years ago, it was I had people told to wear stretchy gauze or a sock on their arms. And so the real problem at the end of the day was actually not even that, because that was a part of the solution. The problem was you're going to have a line sticking outside of your arm. Those people were having it outside of their arm for 6 months. And so they were going to have a PICC line sitting outside of their arm for 6 months, and it wasn't allowed to move. And they were told, hey, if this moves, you can get infected, you could get really sick, you could even die. Obviously being told like worst case scenarios to try and get the severity of it. And so they came to me and said, hey, we can't move this line, what do we do? And so that would be the problem in that regards. And so then we set about brainstorming. What could we do to keep the line in place? We had a lot of great ideas. We had a lot of terrible ideas. I'm trying to remember one of the really bad ideas. I think it was so bad that I threw it out of my memory. But I think at the end of the day, it was, okay, we want something that you can keep the line in place and not move it around. And make sure that it's something that is easily to take care of, because like I don't have a PICC line and I don't want to hand wash anything. So I can't imagine someone that has a PICC line wanting to hand wash anything. I am a runner. You can't tell obviously, but I promise I do run very, very slowly. But I still run. So like trying to think through how can I go about doing daily activities. And then there's also things that it's like, okay, this is something that I don't want to think about or don't need to care about. And I think a great example would be, I'm not going to be going to space with a PICC. Like I'm not going to space anyway, so I don't need to worry about whether I'm going to be going to space with a PICC line. Like that's a tomorrow problem, not a today problem. And so brainstorming both the pros and cons of what you need to solve for. Then it's starting to come up with the design. So this is some of the initial drawings of the patient gowns that we created. In that case, the problem was we didn't want to expose our backside to anyone. And how do you come up with a better solution? What's kind of cool about this actually is our ultimate design ended up actually incorporating a lot of these characteristics, but altering it. But it's okay if it doesn't. And so when you start designing, you want to think through what do you care about, what do you not. For this hoodie, for example, we knew it gets really cold in infusion centers. And so we knew that if you were going to be getting, utilizing a port or a chest port or needing chest access, that you're going to want to be warm. And so when we designed this, we thought of things like this has a thumb loop, because again, I'm a runner and I like the thumb loops. And I wish it was for me, it was really the consumers that came up with that. But also like having access on either side. One thing when we started designing, we realized, hey, people sometimes have a port on one side, it could get infected, they get a port on the other side. And so trying to design for any sort of use case as well. Thinking about technology, where does technology make sense? Where does it not make sense? I remember when I started the company, I had this deck that I sent to PowerPoint presentation that I sent to the Cleveland Clinic and told them, hey, we're going to create wearables eventually. And the guy told me, wait, are you a wearable tech company? Because if so, I'm going to jump out of my window. I later learned he's on the first floor, so it wouldn't have been that bad of a jump. But it was trying to understand what are the technologies that people care about, what are the technologies that scare them. And his comment was, we already have too much data that we don't know what to do with. We really don't want to be spending more on products to get even more data that isn't useful for us. And then the last piece, and this is where you all come in as well, is you want to create products that consumers actually want to wear. And so I think it's really important for you to be involved in the design process, coming up with ideas, coming up with things that you care about. So again, going back, not to harp on the patient gown and exposed backsides, but that's an area where everyone's going to say, I don't want an exposed backside. And so making sure that you're involved and you're able to tell people that, I think is really important. I'm that annoying person that if I see something in a product that I don't like, I'll actually email them and say, hey, I really wish that you would change this. Feel free to do that to me anytime. I always love getting feedback. But I think that it's really important to make sure that your voice is heard. So once you've come up with the design, now we get into the fun part of actually trying to build this. And so this is where, again, just to back up, I'm an investment banker and strategy consultant. I don't know anything about fashion. Well, I guess today it looks like I do because I'm wearing this cool Oscar de la Renta piece. But normally I don't know anything about fashion. I know nothing about manufacturing. I was pretty much starting from like a negative basis. And so utilizing people in your network, talk to people, etc. Dumb luck for me, a friend of a friend's dad sat on a board of a factory. And so they were able to help me get manufacturers that were willing to work with us. As we were building, we also were starting to think through what can we make that is unique about this product? What can we build that makes it easily scalable, that makes it not easily scalable? So this is a picture of our PICC line cover, and this mesh window, which was very much required from a clinician standpoint, makes the manufacturing standpoint extraordinarily difficult because you can't actually use a machine for it. And so you have to have hand stitching, and so then you have to come up with a lot of pictures for the factory workers to know what's acceptable, what's not acceptable. And so that was really, really important as we were building it to come up with all of that. And then you really, at the end of the day, want to get buy-in from the earliest stage because that's how you're going to come up with a product that everyone wants to use. So when I started this, I remember going to Hopkins after 9 months, showing them what I thought was the coolest PICC line cover ever, and the nurses taking one look and saying, yeah, we would never buy that. And I'm like, well, I just wasted 9 months of my life. But fortunately, I was like, well, why wouldn't you buy it? They're like, well, there's no breathability at all for the dressing. And I'm from Baltimore, go Orioles. If anyone's a Yankees fan, you can leave now. No, I'm kidding. What I was told, though, is I was like, well, how about if we use the mesh window from a lacrosse stick? Because in Baltimore, everyone plays lacrosse, even if you don't. And their comment was, that could actually work. And maybe it was just because we're in Baltimore, and again, everyone likes the word lacrosse, so they just said yes. But that allowed us to create the mesh window, is trying to be thoughtful about that. And then kind of like what I was saying, just trying to make it more fun, more usable, making sure when we worked with the factories that we created a garment that could be machine washable was super important. Antimicrobial, when you think about technology, antimicrobial is very easy to do for every factory now. Pretty much everyone does it. It adds a little cost, normally costs about an extra $1 to add it to, but especially in a healthcare setting, it's one of those things that makes a lot of sense. And then different colors and designs, and I say that even though we picked the most boring color and design of straight black. But like, for example, we have partnered with Major League Baseball, so you can wear your favorite team. Unless you're the Yankees, then you can't wear that. Really just trying to make it a little more fun and allowing you to feel, again, more human. Once you have built the product, this is where it gets really, really important. You want to test and evaluate. And I think this is where communication is so vital to success. Letting people know that they're going to be part of a pilot, letting them know that this is the beginning and you expect to make a lot of changes. I think a lot of people make the mistake of, and this happens even more in technology than in product development, but assuming that they have to have a final version and bring it out to the world. How many people here use Gmail? So if you all remember, Gmail for about 10 to 15 years actually had the word beta in its logo. So they were serving over 500 million people and openly telling everyone this is not a final version, but rather we are testing this and we want to get your feedback. And I think if Google can do that, and I don't even know what their market cap is these days, it's might even be over $1 trillion at this point. If not, it's pretty close. If they can do that, then all of us can do that as well. And I think that that's something really, really important for all of us to remember. And so when you're bringing it out to market, you want to develop surveys. And we'll talk a little more about surveys a little later, but it's really important to ensure that you're getting strong feedback and that you're getting opportunity to improve the product. I always hate it when I get a survey that's just a yes/no answer, because that at the end of the day, they basically determine what answer they want to hear from you, right? Like they kind of are trying to guide you to a certain solution. And I think if you truly want to make a great product, you need to get feedback from people and allow them a chance to articulate to you. And so I always like to do either like a five answer multiple choice question with always having an other, or even open text. It definitely makes it more difficult to sort through, especially as you start to get into the thousands and millions of data, but it's the only way to truly get real feedback that's actionable that you can do something about. And then I think it's communicating ahead of time that, hey, we're doing this with you and you're a part of making this a better product. I remember in the early days, we had created these PICC line covers. We were so excited, start bringing them out to market, and the Tampa Bay VA. The lady is an amazing clinician, but very rough around the edges when you talk to her, and you always think that she wants to kill you. Called me and was like, "Hey, chat, black's coming off on all of our dressings. Are we killing our patients right now?" And I remember freaking out, being like, "Oh my God, this is the end of the world." But fortunately, she had been involved in the design and development, and she openly knew that we were still learning on the fly, and so we started experimenting together. And because I had been communicating with her from day one, yes, she was worried about what's happening with black coming off, but at the end of the day, she helped us realize all that was happening was we needed to wash it before giving it to the patient. And so historically, when we had come up with the idea, I'm going to stand back so I don't kick the speaker off. But when we started at the beginning, we were assuming it was going to go to your house. We weren't actually planning on shipping these and it was going to get washed. We weren't planning on shipping it to you to a hospital where they're taking it out of the packaging and putting it on you immediately. And so that was important, where she kind of brought that up, and I was like, oh yeah, we never planned on that. And so we tested it by washing it, and we found that got rid of all the pilling that was happening. And so the solution was you have the factory wash it before shipping it. And by having that communication between the nurse, the consumer, ourselves, and our actual factory, and bringing us all together, we were able to evaluate that and test it and come up with a solution. So then you also want to keep iterating and redesigning. I think at the end of the day, again, similar to Gmail, you should never have a final version of the product. My big selling point whenever I go into a hospital or to any consumer is if we're selling the exact same product 5 years from now, then we have failed you as a partner. I think it's really important to be thinking about how do you iterate, how do you redesign it. Our chief product officer definitely hated me when I told her that when I was recruiting her, to say there's never going to be a final version, because fashion people in particular love saying, look at this great thing I developed, and then move on with life. But I think it's really, really important. And this is an example of UNC hospitals down in Carolina came to us and said, we use extended lumens. So for us, your PICC line cover is too short. We love the concept, but can we create one that's longer? And I was like, hey, if you pay for it, we will create it. So it's like a win-win. You get guaranteed sales also. But more importantly, we were able to come up with a solution for a different use case. And I think that was really, really important. I think the other thing is having that mentality of really, truly trying to improve. I think a lot of people celebrate, hey, I built this great product, and that's that. I think if you want staying power, you need to be thinking about what can we do to make this a better product. All right, and then this is the fun part. Once you've tested and iterated and reiterated and retested and iterated again and tested again and iterated again, et cetera, then you get to bring the market out to the market. And so this is an example where once we had it ready, we were able to start going into hospitals and getting them the products they needed. I think what's really important in this case is also working with the staff and the ultimate buyers, whether that's a consumer, whether that's an actual hospital, to really think through what is going to cause them to want to buy the product and use it in a healthcare setting. All right, so what are some key questions that you want to be thinking of? First and foremost, kind of what I was just alluding to, is how do you get buy-in from day one? How do you get people to say, yes, we really want this? We recently sold our patient gowns to a hospital that took us 7 years to get them to start buying. It's a very long sales cycle. And the lesson there was we probably should have involved them from day one to make that 7 years like 3 months. The second is data, especially in healthcare today and every day. Everyone wants to be utilizing data. And so use pilots, use tests to determine the impact of the product. We were very fortunate in our case. The Mayo Clinic, actually without even telling us, because I wasn't smart enough back then to know that you needed data. So the Mayo Clinic did a 3-year study for us without telling us, showing that our PICC line covers reduced migrations by 78%. And so that was one of those things that then I had that data, I could go to everyone and say, oh yeah, here's a 3-year study done by the small hospital system called the Mayo Clinic. You might have heard of them, showing the efficacy of the product. And that helped tremendously. We also have done it other times where we'll run our own surveys, we'll run our own data analyses just to think through what do people want. So a great example is my chief product officer really wanted to create a port blouse. So something that looks really cool. I was like, it kind of defeats the purpose. You have buttons there. And I kept saying, no, no, no. So then she did a survey of over 1,000 patients showing that basically every woman that has ever bought from us, biggest complaint was we only had one type of port access shirt and they wanted more. And so finally I was like, okay, you win. We'll move forward with that. I think the third piece is continue communicating with your community. I think one thing that we do and is super important to us is to always be interacting with the community, always be asking for help, always be asking for feedback. For example, all of our photo shoots are real people, so we use real consumers, real clinicians. That's been important to me from day one. The way we do that is we just reach out to our community and ask. So it can be as small as asking them for favors to continuing to update feedback and iterate on your products together. And I think that that's been really, really key to our success. Fourth would be, again, not to harp on this, but if you're selling into the hospital, try and get budget for it from day one. Especially, I don't know if anyone's noticed, but in the last 3 years in particular, hospitals have spent several billions of dollars unplanned on, that whole COVID pandemic thing. Unless you go to Florida where they tell you COVID never existed. Bad joke. But I think regardless is trying to build that budget into the plans, recognizing, for example, academic health systems are normally on a June to June fiscal year, and so their budget's reset for July 1st, except for NYU, which for some reason is in August to August. Never really understood that. But really understanding when the budgeting cycles are for every hospital, if you're going into a healthcare setting, or whoever you're selling to, what the budgeting cycles are, to make sure that you can get a successful launch. And then I think it's education. So letting people know about what's going on, what's being done, what changes are being made. For example, based on a ton of feedback, we decided to add a silicone grip to our PIC covers. It's a very minor change. It's something transparently that most people don't even notice. But from a hospital buying perspective, it was, okay, you're causing it to stay on your arm a little more. And so being able to communicate that to them, to let them know, that helped get things over the hump. All right, so finally, how do you receive more feedback? We like to do 3 different things: surveys, interviews, and focus groups. When I started Carenware, I interviewed over 1,000 different people, talking to them about what did they look for, what did they want, what were they using to date to hold a PIC line in place. And I think that that was really, really important. The second thing was using interviews as we continued to design products. So, for example, when we designed our patient gowns, we surveyed over 1,000 patients, and one big piece of feedback we heard was from the bariatric community, which told us, right now, when we go to a hospital, we're given a different color gown. We're bariatric, we know that, and then we're given a gown that tells the whole world, hey, this is a bariatric patient. That really sucks. And so what we ended up doing is hearing that loud and clear and creating a gown where every gown is the exact same color. The only difference is the twill tape on the neck. So your staff can still understand what size is what very quickly and not lose any time. But from a consumer standpoint, no one feels like they're being called out, whether you're bariatric or on the other end, what they call a tween gown, which I've never understood, but it's basically a small gown for like my old 100-year-old grandmother who weighed like 50 pounds and was 5'2". And I think that that's really important to just, again, bring in the consumer experience. So focus groups. I actually like focus groups because it brings people in a room together. I think you're taught growing up that you don't necessarily want groupthink all the time, and you want different people to articulate different thoughts. And I think that's where one-on-one interviews and surveys are really helpful. But at the end of the day, you actually sometimes want to see people feed off each other and see what they focus on if others are focusing on. And so for us, we really like bringing people together and understanding what they like and what they don't like, and how we can improve it, and using that as a mechanism to actually get better ideas from people. I always tell people I have no pride in ownership on anything we've created. And I think it's really important to be constantly improving and coming up with better items. And the way you do that is through mechanisms such as focus groups. You also want a product test. So if you remember back to steps 5 and 6, I had arrows going back and forth between them. Sometimes you will spend years upon years in product testing, and that's fine. I think people get really upset when they don't nail it on the first time. Just to let you know, we went through 12 iterations of our PICC line cover before we launched it. Now we're 9 years in, so we're probably on version like 150. It's one of those things that you always want to be reevaluating, redesigning, and looking at what can you make that's better. And that's great. Like, that's how you get better feedback. That's how you make better products. And then lastly, our surveys. So how do you receive more feedback? We actually have automatic surveys, so anytime you buy anything from our website, you get a very short survey emailed to you. I think it's within 7 days. That asks you for immediate feedback on the product. Sometimes we'll send out follow-up surveys several months later just to get extra feedback, extra thoughts. And then again, if you notice on these survey forms, you'll notice none of these questions have just a yes or no answer, even though these are designed to basically be able to have data manipulated by our team in Excel. So a lot of them are multiple choice, but it allows you to really articulate what you want. Almost all of these have an other, if you have a different answer that you want to convey your thoughts. And I think that that's really, really important. The other thing is you never know until you ask someone. Asking has been kind of paramount to our success. Like when we partnered with Major League Baseball, I just asked them, hey, do you want to work with us? And like normally they probably would have said no, but since I asked, they said, yeah, this sounds great. And I think it's really important to be surveying both on the consumer side when you're selling to consumers, but also on the healthcare side. So when we launch a product with a hospital, we will actually ask them to give out surveys. So normally they want the data themselves anyway, and so we'll help them formulate the surveys that they can then go out and say, look at the added benefit that this provided. And I think that that's been really key and really helpful for us. And I think it's understanding that even your surveys can change over time. So if you see people struggling or you see things that you weren't expecting, you can then adjust their surveys in real time to be getting different types of feedback, et cetera. And so with that, I want to open it up to any questions that you all might have.
Can I have this? First of all, I would say thank you very much for presenting that. I just want to share very quickly from an Oley perspective, one of the reasons we asked him to do this is because, I mean, it's about this specific type of product, but like you can extrapolate that to all sorts of things. Or if you look in the exhibit hall over the last 2 days, you see all sorts of customer-led, patient-led things that were designed. I mean, I can name them off the top of my head, right? Some of the things that are in there because somebody saw a need, said, hey, I could do something about it. And what Maisie and I and some team that we're going to build is trying to say, if you are at the very beginning and you say, hey, I see a need, and here's some thoughts. We want to hear those, right? The next level is maybe I have a thought and I said, I have it on a design on a napkin. How do I take it to the next step? And then maybe there's somebody who says, I've got a few of these and I've started to produce it, but I don't know how to take it to market. So is there a way that Oley could help do that? The next one is once you're already thinking, hey, how do I do this? How do I mass produce it? Which is where his level is, right? Mass produce this. And then maybe it's the, how do I mass produce it? And now can I sell this to a bigger company so this can even go bigger? And now I go, retire and have money in my bank, right? Theoretically, right? So there's like where along the way you are, and it could be everything from I have a problem and I need a solution all the way through, where he is, where, like I said, I go down the list of all the different names in there. So it doesn't exist. The pipeline doesn't exist right now, but that's where our brains are going, and we want to build that. So if that's something, either you have ideas, great. If number two, you want to help shepherd this along and be a part of that innovation task force to build the pipeline, like I heard you just volunteer. I don't know if you knew that, but I heard that. So didn't you guys hear that too? We need people to help build that pipeline too. So thank you, first of all, for being here today. And yeah, if you have any questions either about his products, about the process, this isn't a commercial. This is a, how do we do this? How do we get to the needs of the community? Thanks so much.
And
He's giving you
one real quick thing would be, you bring up a good point where you don't need to be necessarily thinking about how do I create 50 billion of these at the same time. Like, there's now platforms like Etsy that actually make it really incredible for you to be able to sell 3 of them. And I think that that's one thing that we all like to think about, how are we going to create something to get us to our Caribbean island where we can retire? But like, there's a lot of points in between where you can still make a difference. Yeah.
Thank you very much for the talk. I think it's a great lesson on how these products should be designed. Number one, I was wondering if you could demonstrate a little bit about the hoodie.
Totally.
And is that something that's
And don't worry,
available?
I'm wearing a t-shirt underneath, so no one has to see my skin.
Only if appropriate.
Yeah. So it opens up on either side, gets you full access to the chest. This one has a snap, so you can actually, if you're in there, you can leave it open and be getting the infusion, but staying warm. And then the idea is when you're not, that you can just go about like you're wearing a hoodie every day.
Is that available, or
It is, yeah. So it's on our website, karenware.com. Yeah.
And my other thing was, one of the most vexing problems for these consumers, no matter what type of line they have, seems to be swimming and showering.
Yeah.
And finding, it seems like not every product is right for every person.
Yeah.
Some people say one product works, one doesn't. And so that's probably, is there anything in the pipeline on that?
Yeah, swimming has been very difficult. We have a shower sleeve now, so we have 2 sets of shower solutions. We have one for a PICC line or any sort of line on your arm, and then we have one for casts and things like that for both your arms and your legs. A lot of people have asked for something on the upper half of your body. We haven't been able to come up with anything yet that would keep it dry, because from our point of view, if we're going to create it, we want to make sure that it stays dry the entire time. The best solutions we've seen for that are those like disposable ones, but that, to your point of swimming, would not allow you to swim, just a shower. And we as a company are very big on sustainability, so we would never do anything that's disposable. So we've stayed away from that, unfortunately, but it's top of mind. It's just until we come up with something that we know works, we don't want to bring it to market.
Thank you.
Yep.
I just had a quick question
Yeah.
about your line. Do you have any attire that allows for access of enteral devices like tubes and stuff?
Yeah, right now we don't. It's been top of mind as well. We, at one point, were working on an all-access shirt, which was going to have zippers everywhere. But it's gotten very complicated to do that, and people complaining, well, if I need access down here, I don't want a shirt that has a zipper up there, et cetera. So still something in the future, hopefully.
Thank you.
Yeah.
Do you have any advice on taking an idea to a company that already produces something similarly?
Yeah, it's tough because I think from your point of view, you have a unique idea that from their point of view, they might think that they've already had that idea. Normally what I do, and I don't, is Rhonda still here? No, yeah. So Rhonda, amazing person who has come to me openly and said, hey, is there a way that we can partner together or work together? And from my standpoint, it's, hey, we kind of make some things that are similar already, and there's certain reasons that we might have done the way we have that from her point, and we're friendly, so I can say this openly, knowing that this is being recorded and she might look at it. But like from her point of view, it's, hey, I created this for my own reason, and from my point of view, it's, well, I created this for my own reason. I would normally try and get an NDA if you can. And if you need one, you can follow up with me. I can send you ours that you can just copy. You should never spend money on things like that if you don't need to. But it only works for a limited amount. But I generally find more success for people that don't have something similar than for people that have something similar. Because there's also a lot of companies don't want to be told that their product is inferior. And so they take that, not personally, but they're less likely to be willing to work with you.
We have time for 2 more questions. We got 2 right here. So why don't Chris will actually go first, and then you're going to be next, and then you can talk to them afterwards.
Sure.
So you go next. Yes.
First, I want to say great presentation. You simplified Lean Six Sigma beautifully.
Great.
My question to you is, what other I won't. Never mind. I won't ask my question because it's going to be a very detailed question. I'll just give you a comment. One innovation on that I would do is to make it easier to access for people who have limited mobility is put an actual zipper in the middle, like a fleet.
Yeah.
Yeah. I won't ask my other question.
Okay.
Pew matrix and all that fun stuff and how you guys analyze.
No problem.
Thanks so much.
That will be our last question, and then we'll have time afterwards. Go for it.
Okay, first of all, I love my camera shirt.
Oh, awesome. Glad to hear it.
You mentioned like hospital gowns
Yeah.
and stuff like that. Do you guys have any plans in the future to like coordinate with hospitals? Because like, I feel like one of the bigger problems is for us is that they're way too big.
Yeah.
Really way too big and just not easy to deal with, especially when you have a line. So I typically wear my own clothes
Yeah.
in the hospital.
Yeah.
And yeah.
Yeah, it's,
But if you have like a procedure, you have to wear.
if you're
like, the gown.
inpatient, you normally have to wear. Outpatient, they now a lot of times will allow you to wear whatever you want. The hospital gowns are sold mainly to hospitals. So to your point, we'll be announcing in September a very massive deal where our gowns will be used across the nation with a big hospital system. And we're starting to that's a huge driver for the business.
The question, does that have to do with Cleveland Clinic by chance?
It does not, unfortunately. Yeah. Yeah. You might know a guy that can help.
Yeah, you know a guy. Thank you guys.
Thank you all so much.
Appreciate it.